Good afternoon, everybody, or good day. I'm just setting my timer so I won't go over or go under. So give me 1 second. Resume. All right. So this is the third session for you guys, and this one's going to be covering everything you need to know about the updated version for IP22, EMT2, or the EMR to EMT bridge course. As we go through this, if you write down any questions you might have, we can answer when we have our live session. Please do. I'm gonna go through it fast. And I realized that I did not cover a couple things in the in the second portion, that your IP21 was EMT2 EMR, it should be EMT1 EMR course. So I will review those real fast. I talked about what chapters we're going to be using out of the EMT book, but I didn't actually number them. So we'll go back and do that as we're reviewing for EMT2. So like I start off in the second one, we'll start off for this one. So let me go up here and me share my screen. We're going to start with the information from the state. Let's go to state information. Come on. All right. There I am. Let's make sure I'm still up there. So, and I apologize. Apparently, my camera quality is not that good once I start trying to share, and I apologize. I was looking at it last night, but these forms can be found online, and you'll have where you can find all those forms for yourself. So this is actually off the North Carolina Office of Medical Services webpage. This is the EMT education program requirements. This is effective date was January 1, 2021, and implemented 4 days ago. This is July 4th. So it was implemented 4 days ago. EMT education program requirements. So we're going to review these really, really fast. Then I'll go over each little step for how we do it for our program, and we'll go over some of the different appendices from our program's plan that specifically follows for what we do for DPI. The North Carolina educational program must be conducted by an approved educational institution as defined by the rules or law of North Carolina Medical Care Commission. Ours is a fully approved educational institution. The name has now been changed from educational institution to an education program. So our educational program is fully set there by the state of North Carolina. One of the things we're going to be talking about when we actually get to one of the other sessions, what we're looking at for the next 5 years. We'll be open to the floor for some discussion about actually becoming accredited by one of the different agencies that accredits for accreditation. Is usually going to be for most of your ALS levels of education. But I think this might be something we might want to look at if the price is right. So everybody can totally get approved. Our program is approved by the National Registry. So when our students come out, they can actually test for the National Registry. So if you have any students you want to test, all you have to do is send me their name and send me their name, their P number when they tested for their technical scope of practice, and I can go in and actually approve them for the National Registry. Now, if you don't send that to me, I don't approve them. I don't know these students. If it's one of my students, I can approve them. But if you don't send them to me, or you don't let me know that they're applying to go to the National Registry, I don't know to do it. So please make sure that you do that. But we are fully approved by the National Registry. We're also approved by the NAEMT to teach both EVOS and EMS safety. We'll talk more about that. We'll get to that video also. Your lead instructor for the EMT educational program must be a North Carolina certified level 1 EMS instructor at the EMT level or higher, defined by the laws of the North Carolina Medical Care Commission. The curriculum for the EMT education program shall be the minimum, the most current version of the National Education Standards, and they are. These educational standards must be adopted and approved by the North Carolina Office of Emergency Medical Services. The evaluation check sheets for verification of student independent skill mastery shall meet the minimum criteria for those developed by and maintained by the National Registry of EMTs, specific to the independent skills learned during each specific educational module. So the National Registry has just changed their EMT curriculum when it comes to your skills. They've also changed your advanced EMT and your paramedic. So there's some things we have to go through and change. We got to take out the backboards. So we'll be talking about that when we get to that. We get to the actual skills and that sort of thing. So we are having new skill sheets that Melissa, myself, and Sam are doing over the summer that you'll have in place. And I apologize they're not done before now. The goal was, but they're not, because we're making some changes that we just talked about on Friday. So we'll talk about more about that, and then when we get to that portion. The educational institution must maintain all student records that document A, compliance with the student's prerequisites of the high school diploma, high school equivalency, or that of the 11th grade reading level. So this course, EMT, or your IP22, EMT2, EMR to EMT bridge, has to be a high school senior. This person has to have completed, finished their 11th grade English. They cannot take it concurrently. They have to have finished it, have to have passed it. If we let somebody into the classroom that has not passed their 11th grade English, then we are breaking the law. Plain and simple. They have to have passed their 11th grade English. Any learning disabilities that may qualify the student or for special consideration by the Office of Emergency Medical Services in a written credentialing exam. So if there's any IEPs or 504s that might get them to have a change situation when it comes to their state testing, we need to have that and keep it on record. Student attendance in the classroom and any clinical or field internships components required by the educational program. Here again, like I said, under the IP21, EMT1, EMR, of course, when we're looking at the state rules and regulations for that, we talked about the possibility of an attendance record. We keep attendance in Power School or whatever your school uses. Most of us across the state use Power School. So we have an access to know when they were actually there, when they were not there. Your school requires to take attendance, and we are required to take attendance for DPI, but also for the North Carolina Office of Emergency Medical Services. I do want to have a discussion when we have our open discussion area about the possibility of adding an attendance. It has been widely spoken, and a lot of people have followed for their program the 10% rule, just like the colleges do, which puts us right at no more than 9 days a semester. But it's not in writing at the state level, and it's not in writing anywhere for us as a actual program. So if we want to add this so it can be legally documented and legally in one of our documents, so we can say if somebody says you can't do that, it's actually in our document, then we can. But here's the deal. Once we do it, then we all have to follow it. And as missed 9 days, that means for any reason, whether it's approved or not, whether it's an approved educational experience or whatever, if we put it if we put it in writing, then it doesn't matter what. I don't know about you guys, but I had students this year that missed about 13 days, but 5 or 6 of those days were actually accredited or not marked as absent. But there's a difference between DPI's absentee and North Carolina Office of Emergency Medical Services absentee. So we have to discuss that if you guys are wanting to do that. Then we have to document successful completion of all components of the program, including written examination scores. And those, we don't have to keep their actual test scores. We don't have to keep all their quiz scores, but for OEMS. But for your school, you do. Independent skills evaluation sheets, and then your scope of practice or their TSOAPs. Your educational student prerequisites. They have to be age 17 before the official end date of your course, which would be the end date of your actual class, not what is in Continuum for us. Because sometimes our date for Continuum is different than our date of our end of our class. Number 2 here does not affect us because we're actually teaching this in the high school, but it does say they have to have at least a 11th grade reading level for comprehension. So here again, this law is required. So they have to have completed it prior to them taking this course. They cannot take it at the same time they're taking the EMT2 course. All right, so your didactic component, it's going to be composition of your didactic component will meet the most current education of the national education standards. I'll give you guys access to all this information and where we find these documents, so you guys actually can go look at them. You need to be able to review them from time to time. I review them once a year. sometimes twice a year. It all depends on what else is going on. To ensure that the EMT student obtains all pertinent information or education for EMS in North Carolina, and the inclusion of the medications and skills related to this scope of practice, as an EMT will be required to cover throughout the course. To determine what medications and skills are applicable, refer to the current document with the North Carolina approved medical board approved medications and skills formulary for EMS personnel. Where is that found? Glad you asked. Look over here. We'll come over to this in a second. There you go. ncems.org/nccep standards.html. This has your North Carolina medical board approved medications and approved skills. This is the protocols that we'll be using in our classroom this year. I don't want, you can show them other counties protocols, but this is the protocols I want used in the classroom. We're going to be using across the board the same protocols, so we know what's going on. So this is where it will be pulled from. The North Carolina protocols. Your county's protocols are based off of these, and then your county can add to it or take it. They can't take away from it, they can add to it. Your EMS patient care related, operational policies, procedures, medical director information, then your different appendices. Gives your patients, your students a lot of good information here by these. Go back over here then. All right. Lesson planning for the delivery of the course material by instructions should be delivered from the current EMT instructor guidelines, and that can be found right there at ems.gov. If you are using what we are wanting you to do, where your students do their actual PowerPoints at home, through Edpuzzle, that leaves you to do your evidence-based education, your problem-based education, your case-based education, or your scenario-based education at the actual classroom. Get them in there. Let them do their schoolwork that they need to do at home. And then when you get in there, run scenarios with these students. Run scenarios. Review their drugs with them. Actual run calls with them. It's not an actual call, but run a call in your classroom. Put what they're learning to practice. Chapter on anatomy and physiology. Walk them through and do a patient scenario with them where they have to go through and also discuss and define their anatomy. Do something to make this fun for them, not just learning. It's a lot of information to learn. It's a lot of pressure to put on high school junior and senior. So let's have a little bit of fun with them. Let's flip the classrooms, or what do you want to call it? Do the lecturing and stuff through Edpuzzle, and then have fun with them in the classroom. Yes, it's going to be from time to time that you're going to need to open up for discussion and have discussions with these students about these topics. But you can have a little bit of fun with them on a daily basis. I don't know how your class is. My classroom is set up. Usually we do 3 things during the day, during the course of the 90-minute classroom. 30 minutes or more are going to be a scenario. 30 minutes or more, I give them a chance to actually do their schoolwork sometimes. And then the other 30 minutes we are going to do, whether it be another scenario based or work on skills. There are days that we just do skills, just like you do, and there are days that we just run scenarios. There are days that we do protocol drills. Where do you find this protocol? Or here's a scenario. What protocol will you use? Where is that protocol? What's the protocol's number or letter, or what do you want to call it? So I know they're actually in the right protocol. How do you know what drugs you can give as an EMT? And you learn the drugs that you can give, but here's your protocol book that really specifies what it is. If you need to, we can order a big order of them and get them done both 8.5 by 11 or the small. We get 4 of them on an 8.5 by 11 sheet protocol book. These run you about $25 a piece, and the big one run you about $25 a piece also. Each one of my bags for my students, for the 4 bags we run per classroom, has a protocol book in it. I have a set of protocols that I can just flip to what I need to do, but they're right here in your actual, on the computer. So you don't actually have to print them, but I like a printed copy. I'm an old goat, I want my printed copy. And I teach my students to have a printed copy because then they can pull it up. They know where it is, give me their pocket. Sometimes this dies. Sorry, get off my soapbox. So let's do that as we're going forward to that, and for your that's your didactic part. Use your didactic part, being Edpuzzle, but also having fun with them in the classroom to teach them all the information they need to have. So go through the books, the actual one I just showed you there, the instructor guidelines, and also the one up here where it comes to the National EMS Education Standards. These are good places to go to. Go look at them. Go actually look at the actual what you need to be teaching. Each chapters covers the information, and it's already done for you. But if you want to second, if you second guess it or you want to go check it, I've done it before. Click on one of these places. I'll click it up for you so you can go see it. Here's your different information you can go look at. Your agenda for the 2050. Everything else you want to go is right here. The other places you can find it, I'm gonna go back here for a second. Go back to where I need to be. Go over here. This is one of the easiest places to find it. Go to the National Registry, NR EMT. All right. Go to the EMT certification. Go over here. This is the national standards, resources. National EMT educational standards, National EMS scope of practice, National EMS standards over here again. That's the EMT standards. This is all EMS standards, National EMS core content, and the 2020 AHA guidelines. This also gives you other different links that you need to have. Then when we need to make sure that we are covering, when we're talking about our skills, but we want to make sure that we're actually covering what we have to cover as for EMT, this is right here where you have it. This is the 1, 2, 3, 4, 5, 6, 7, 8. We're used to either be 10 things we had to do. Now we only have to do 8 for the EMT. Let's go look at the EMR. There should be 5 of them. Oops, let's go to, here you go. Second motor. 1, 2, 3, 4, 5. So that's where you find all this information. You'll be able to know where to go for it. I look at this stuff constantly. I'm constantly looking at it, reviewing it, trying to get more ideas to be able to get these points across to these students, so they can come out better and know the information that they need to know to be better EMTs and be better clinicians. All right, so we talked about the actual didactic part. Now let's talk about clinical. Now, unless we are under guidelines because of COVID, your students next year will be required to do 48 hours of clinical, whether it be field internship or in an ER. That is law, and it will have to happen. If it does not happen, then that student will not be able to go test for their EMT, unless we're under COVID restrictions and we are able to do the patient simulation in the classroom in the lab setting. The Local Office of EMS encourages EMT students to observe emergency department operations for a period of time sufficient to gain an appropriate or an appreciation for the continuum of care. Going back to chapter 41 of our book, talking about your continuum of care, working as a team, that sort of stuff. These students need to get a chance to see it. It's going to be hard to do that, especially if your students are under the age of 18 when it comes to get them, especially in a hospital. It's easier to get them to get a ride than it is to get them in a hospital when they're under 18. Students are encouraged to actively participate in a field internship, as this educational component will enhance the overall education of the EMT student. Students must, that's not should, it's must, perform 10 patient assessments. The patient assessments can be performed in an emergency department, an ambulance, a clinic, a nursing facility, a doctor's office, and etc., and even including riding a fire truck as a medical responder. We got that approved, and it is in our education plan for the 2 counties that we know of that cannot ride an ambulance, but their fire department will allow them to ride. Your clinical and your field prerequisites: successful completion of all EMR educational requirements. That is why we state when it comes to the EMR to EMT part, number 1, they have to have passed EMR, your IP21, EMT1, EMR, and be available to go sit for the EMR, their EMR certification, but are required to have their EMR. Recommendations of the educational medical advisor and program lead instructor. Now, this recommendation comes from you. If you tell me this person is ready to go, then I believe you and they can go. Participation in clinical or field setting may occur after students have been evaluated and possess the ability to perform all applicable skills in the pre-hospital setting. So you need to make sure that their skills are done to the point that they can at least at the EMR level, before they start writing. We have this taken care of by making sure we have everything done in the first semester with IP21, EMT1, EMR. That was your prerequisites. Now this is your requirements for your clinical. Students should observe emergency department operations for a period of time sufficient to gain an appreciation for the continuum of care, if approved by the medical advisor or program coordinator. Students must participate in and document patient contacts in the field experience approved by medical advisor or the program directors, like I said. Field internship must be performed with an EMS provider at or above the EMT level. Your preceptor or the student's preceptors have to be at the EMT level or higher. Students must perform 10 live patient assessments. These can be performed in emergency department, ambulance, clinic. So it's already been said. Successful skills completion. To successfully complete the EMT program, the student must demonstrate competency in each of the following skills during the clinical education and field internship educational components while in the direct contact with a patient. It goes in and tells you what they have to do, which is the 10 patient care things, skills, assessment, patient interview, and history taking. So where we need to be reading from and make sure that they're doing this on a daily basis, doing their skills. Your physical exam, field impression and treatment plan, therapeutic communication and cultural competency, skills performance. And as we're redoing our formative assessments for these patients, for the students when they're doing their clinical scenarios, we're trying to put into place where we make sure we cover all this right here, all this information. So we're getting this and we can actually then show it and have proof that the students have done what they need to do at all levels. Your field impression and treatment plan, professionalism, and your scene leadership and safety, data collection and record keeping. Then your clinical field experience here again is going to be required. They're going to be required to cover it and be ride for 48 hours. Same thing there for all your treatment plans and everything they need to do. But here's where we have some more new stuff we have to cover. The following represents a summary of the required components and minimum time requirements for the emergency medical technician program. The didactic skills labs, written exams, and your scope of practice equals 192 hours. This section must is underlined and bolded, include the following: EMS credentialing and maintenance and renewal components, state requirements and national registry. As of July 1, some things have happened and have changed. I left that one out there. Students used to have 3 chances to take the test. Your first attempt had to be in 90 days. Then you had, another more or less 9 months to complete the other 2. And if you didn't pass it, you could go take a refresher course and then go get 3 more chances. No more as of July 1. You have to take all of your 3 chances in your first 90 days out. I'll go find that one for you. We'll talk about it later. Then there's no, once you finish your 3, there's no chance to go back and take a review, just a paramedic review class or EMT review class, and then take the next 3 testing at all. There is 3 tests. Don't pass it the 3rd time, you go back to the whole course again. We'll talk about, I have to get that one. We'll talk about more about that, the paperwork and that sort of thing. There's a minimum of 48 hours in the clinical and field setting. So your total is going to be 240 hours. But I also want to say here, your EMR has your TIMS in it. They're required to have TIMS. And then EMT has to have your state or nationally recognized emergency vehicle driving program to include a physical driving component utilizing a type 1, 2, or 3 ambulance. We are teaching the NAEMT EVOS course. You will be required to become an instructor for the NAEMT to teach that portion of the class to your classroom students. Then, if your school wants you to become an instructor, you will have to sit with Kim and I, or come drive with Kim and I on an ambulance, and we will check you off to go do your own testing if you want to when it comes to the driving portion. Or you can use the organization that we have formed a plan with, and that is Street Safe, who has bought ambulances, have insurance, and have bought into this program because they believe in this program, the EMT program in the high school, the EMR program in the high school. It's a group of emergency medical responders, police, fire, and EMS who want to see these kids succeed and want to see new people succeed in EMS. So they bought ambulances. They have the cones. We have 2 ambulances. One of the ambulances was old 4 Oak 61, which is the last ambulance that I rode full-time in EMS on. So before I retired off the trucks the first time. So it's kind of a great thing to do, to go ride an old ambulance I actually used to ride. So we have those, though we are planning what we're going to do this fall and the spring session so that we can get the EVOS course out of the way and the driving portion. The driving portion takes about 4 to 6 hours. All depends on how many students you have. We can take 20 students at a time, but these students actually have to drive 4 parts of a driving course: backing, the serpentine, changing lanes. Then they also have to do the the narrowing of a side street. There's 2 others that they can do, but they are required to do those 4 for the driving component. And here's the thing: we're very well aware that some of our students are not even, they won't even have their they won't even have their driver's license when they take this course. The NAEMT EVOS course is the only course of there that's up there that the person is not required to have a driver's license to be able to take the driving portion. Street Safe has the insurance. They have everything they need to do to come in and teach the courses on a school campus. We're not driving on the road, so our students, even without a driver's license, can legally drive on their school campuses if your school campus allows us to come in there. The person who actually is running the Street Safe is Kim Miller, or Chief Miller over at Garner Magnet High School for the EMT program. She is overseeing the Street Safe as a member of Street Safe. I am a Street Safe instructor. Just became one because of this. And we have opportunities that are out there for you if you want to become an instructor. And right now, we're not planning to go to every school. We're planning to come into the region, probably have 2 courses or 3 courses in every region. And you'll need to bring your students, whoever wants to get certified to go get their EMT, will be required to come to that regional test area to go through the driving portion for that day. We'll have more information about that throughout the summer. And as Kim and myself and all the other instructors are getting together and discussing where we think we can do these, what schools are going to allow us to do it. And your school is going to be required to have an MOU with Street Safe. There's 2 MOUs right now that are approved. Durham City of Medicine's is approved. And so is Wake County students, 3 schools. Garner Magnet, Athens Drive Magnet, which is the 2 in Wake County. MOUs have been approved, and so the school, Durham City School of Medicine has been approved MOU. They all 3 use the same MOUs outline, but it's been approved and turned in back into the DPI. So the whole course for EMR and EMT is going to be a total of 240 hours. Your EMR course is right around 90 hours, and then add in everything you got to need to add in. So you're at another 150 hours to get their EMT. So any questions about that? Me, Mark, what I've talked about today? Got your intro. You got your program requirements. All right. So as we looked at yesterday, let's also go look at your format of your forms that we're going to be required to have everybody turn in. It's supposed to be a Word document. And I guess I closed that one out. So give me 1 second. Oh, that's the form I thought I was looking for. So yesterday we went over both of these for the IP21 EMT1 EMR course. Today we're going to focus on this one here. So why are we required to keep this information? Part of this is that action plan that I told you about yesterday that I'm required to put into place because we had instructors who did not get their patients' number 1 P numbers for students. And then number two, we had instructors who did not, once they got their P number, get them registered in Continuum for their course within the first 10 days of the course. And once that first 10 days after that course is open, it locks down. I can get them in for about 3 or 4 days after that. After that, I've got to contact either San Juan Timmons or Todd Messer or one of the other educational liaisons that I can contact to get them actually put into Continuum. But since DPI's main hub for these courses is actually in Wake County under DPI, I usually have to either do San Juan or Todd themselves. So the EMT2 or IP21, excuse me, IP22, EMT2, EMR to EMT bridge required documentation. This is a piece of paper that you will have printed off and done for every student's name and the school year and the instructor. Students required in Continuum or registered in Continuum. They should already be registered because they had to register for EMT 1. Their P number must be within within 10 days of the course approved by EMS put in. Yes. Students completed your attestation requirements stating that they're not going to talk about anything they're not supposed to based on confidentiality. Is the student aligned with the course? In other words, are they in the course? If they are in the course, what's the course number? Right there. Student date of birth at the end, at age, student date of birth and age at the end of the EMT2 course. They must be 17 by the last day of the EMT. The new one actually says EMT2 course. So I apologize about that. Here again, 504 plans, IEPs. Have they completed 11th grade English? Yes, no. Completed your NA EMT EVOS course, certified? Yes, no. EMT 2 skill sheets, documentation of the 10 live patient contacts. Have they completed their 48 hours of clinical or field internship? Then we will need to know their EMT overall course grade. Their EMT TSOPs completed? Yes, no, and their grade. Their final exam grade. And if we had to remediate this person in any area of their course, please explain comments that they were remediated. I don't have a problem with you remediating anybody that you need to remediate, but if it's one of those areas that we need to document, then please document. Is this student eligible to sit for the state exam? Yes, no. If no, explain in comments. Patient did not have a higher than an 80 degree overall. So whether this person, and this is to be on every student in your classroom, IP21, IP21, EMT1, EMR now has a hard cap. Now has a hard cap of 20 students. Did you hear me? 20. The hard cap for EMT1, IP21, EMR is 20 students. The hard cap for IP22, EMT2, EMR to EMT bridge is 16 students. Right now, it does not state that on the Moodle. We're trying to make sure that is all updated, but that is what is in our plan. That was what was approved by the regional coordinators and by Dr. Barber and by the state of North Carolina. So once again, the hard caps for EMT1, IP21, EMR is 20. The hard cap of students for IP22, EMT2, EMR to EMT bridge is 16. A hard cap is a hard cap. It's not to go over it. Not at all. Believe you me, you don't want to hear Dr. Barber if you go over it. Take it from me. You don't want to hear that. Because then we're in violation of number one, our educational plan. We're also in violation of different rules and regulations when it comes down through was it not Hutchinson? What is the new people giving us money? I don't remember their name. All right, so that's that. So we'll be doing these papers, these little pieces of paper on every student, and they'll be kept for their records for how many years? I just gave you the answer. 7 years be kept on record. So you'll do one of these for each student in EMT1, each one of these for each student in EMT2, and be kept for 7 years for each one of them. All right, so the book we're going to use for the EMT course, we're still using the 11th edition of AOS. Next year, we'll be converting totally to the EMT AOS 12th edition. The slides that I'll be sending out for everybody to record and send back to me. So, and once you put them on Edpuzzle, send them back to me so I can put in there. So every one of your students can have a lecture from you, and a lecture from every other teacher here in North Carolina will be from the 12th edition. So it's done. You're not required to buy new books this year, but you'll need to be telling that your CT directors that in the next year or so you will need to buy new books. Where does that come from? How is that a rule? How's that a regulation? Let's go back over here. Okay. So you have to use a current book. 2011, excuse me, the AOS 11th edition does not teach the 2020 AHA guidelines. They teach the 2015. Is that a current book? Is that a current thing listed for your National EMS Education Standards for EMTs? No. AOS 12th edition will be. So we are required every time there's an AHA update and every time there's an update for those books to go ahead and update them. Usually we can get it done within 1.5 to 2 years, but as long as we're teaching the new information. I know that every one of your schools are not going to buy a book for every student. They're going to buy a set of classroom books for you to have in the classroom and have to check the book out or however they do it. But we'll have to update it in the next year or so to get EMT, the AOS 12th edition books in the schools. Take it from me. Try to get your CT director, your LEA, whatever it's going to be, it's going to buy in your books, to go ahead and spend a little bit extra money and get the hardback books, not the paperback books. The paperbacks do not hold up when it comes to student handling as much as our students will end up handling our books. Alrighty. So look at the bridge and the pages and the chapters and stuff. All right. So yes, in earlier presentation, we looked at your EM1 or your EMR book and what chapters come out of your EMT book. We talked about that. We discussed there's only 2 chapters in your EMR book that are going to be used for your EMT class and for your EMR class. The rest of the chapters will actually come out of your EMT book, so we don't have to go back and reteach everything. So we're going to be just a fast overview for your EMR. The only 2 chapters that you have to pull from the EMR book, and we'll do that before the beginning of class, is going to be your chapter 10 and your chapter 14, because it's going to be an overview of all medical emergencies and then an overview of your police, I'm assuming of your bleeding, your shock, and soft tissue injuries. And then as you see here, it's almost chapter by chapter when it comes to all the other chapters that we're doing for our EMR to EMT book. In the EMR book, chapter 1 is EMS systems. In your EMT book, chapter 1 is EMS systems. Chapter 2 is workforce safety. Workforce safety, chapter 2, both are the same. Chapter 3 is lifting and moving for your EMR book. Is chapter 8 in the EMT book, so we're using chapter 8. Chapter 4 is medical, legal, and ethical issues, and our EMT book is chapter 3. In the EMR book, chapter 5 is communications, and the EMT book is chapter 4. In your pacing guide, we have it listed as EMR book for communications, chapter 5, EMT book, chapter 4. We want you to go ahead and use the EMT book. Why? Think about it. For the pacing guides put out by DPI for your EMR, let's like this right here. This is IP21 EMT1 Emergency Medical Technician course. So this is how it's listed. Understand the basics, the basic preparatory information for emergency medical responder. Apply basic procedural knowledge of airway. The only difference between that and this is now it says advanced there compared to basic. So as we're looking at this, we want them to go ahead and use the EMT book, so we don't have to go back and cover as much information when we start IP22, EMT2, and your EMR to EMT bridge. Goes on down here. So this is the chapters for EMR book. This is the chapters for the EMT book. We all have all the chapters are there, with the exception of having to add chapter 10, medical emergencies, and chapter 10 over here will also be not from the EMT book, medical emergencies. Chapter 11 is poisoning for the EMR book, poisoning and substance abuse. Chapter 21, toxicology. Chapter 12, behavioral emergencies. This is our chapter 22, psychiatric emergencies. Chapter 13, the EMR book is going to be chapter 32, environmental emergencies, in the EMT book. Here, the two are the same. Chapter 15 in EMR is injuries to the muscles and bones. Chapter 31 in the EMT book, orthopedic injuries. Chapter 16 for EMR is going to be childbirth, and your chapter 33 in the EMT book is going to be your obstetrics and your neonatal care. Chapter 17 is pediatric emergencies. 34 for your EMT pediatric emergencies. And here again, this is all the same, even by name, just the different chapter number. Then, what that leaves us for our EMT 2 course, or your IP22, are these chapters. Chapter 5, medical terminology. Chapter 7, lifespan development. Chapter 11, principles of pharmacology. This is going to be from your preparatory. So you went from basic information from preparatory to advanced, covering medical terminology, lifespan development, and given some pharmacology. The respiratory section, respiratory emergencies. Then you're going to have your other medical, cardiovascular emergencies, chapters 16, 17, 18, 19, 20, and also 23, which is going to be all your medical. Your trauma is going to cover shock, bleeding, soft tissue injuries, face and neck injuries, and spine injuries, chest injuries, abdominal, and your injuries for your trauma. And you're also going to have an advanced level for special needs patients, and then also have your crew resource management, or your, what's the other one, ops, your terrorism and your team approach. So these are the chapters we have to cover in IP22, EMT2, EMR to EMT bridge. So what we're going to just going to review what we did, just go over it a little bit deeper. Here again, this is where your skills come in, and doing your patient scenarios are even more important to get these students ready to where they need to be. Now I'll show you this right here. We're already starting to do the new book. This is on the 11th edition. I already have one down here for the 12th edition. I'm not going to worry about it with you right now. So you have that. Okay. Here again, we will be sending out PowerPoints for you guys to all record. You need to, as a teacher, you need to go ahead and set up your account in Edpuzzle. Record your video, save it as an actual YouTube video. Go to your Edpuzzle, upload it to your Edpuzzle, and then put your test questions in there. Need to probably have at least 10 quiz questions as you go from the chapter. And then you're going to give us all the link to it, or tell us what it is, and we're all going to go in and we're going to get all the different ones we need for your Edpuzzles. So we have a full list of chapters 1 through 41 for every student to be able to use in their Edpuzzles. All righty. Then we already looked at the NCDPI advanced pacing guide. So this is all it is now. It used to be a lot more. It breaks it down to how many days we need to cover this, how many teaching days we need to cover this. And then this right here actually will go from here to this pacing guide, which is the day-to-day pacing guide for EMT2. Okay. So this is your EMT2. I'm going to notice up here. Okay, it's saying that it's too much information. So let me go back here. You find something that's not too worried about. Hopefully this one will be fine. Okay. Even the same warning yesterday, and I apologize for getting this warning. Hopefully you can still see this. This is your pacing guide set out, day by day. how to go and break down this information here by the days. Okay, it's not showing my screen anymore. So need to figure out what's going on here. Sorry about that. All right. Screen is sharing again correctly. That's how I need to fix it. I need to stop sharing the screen at the time. So this is the state's pacing guide. This is the pacing guide that's actually put out for day by day. The state gives me a list of dates and how many dates I need to do it. So it gives me a list of dates, how many days I need to do it. You know, for understanding advanced preparatory information for emergency medical responder, or you're going from your EMR to your EMT, is 10 days. So we have 10 days to cover the 3 chapters we needed to cover in preparatory. We have 3 days to work on airway. We have about 13 days to have 9 days, 8 days to work on your airway, 13 days to work on your patient assessment, 28 days to work on medical, 15 days to work on trauma, 6 days to work on children and infants, and then your 5 days to work on your just advanced potential knowledge on EMS operations. So how does that break down for a pacing guide for us as teachers to be able to get all this information in? Okay, go to that one again. I'll go to this one, just in case. So this is 2021-2022 Emergency Medical Technologies 2 Honors Pacing Guide. Remember, EMT 1 and EMT 2 are not inherently honors, but they are an honors level course. If you want to go through the paperwork to get them honors, you should. Get your students a higher number of points or whatever on their GPA. This is an NCOEMS EMR. It's actually supposed to be EMT certification. So this is actually a certification, and your proof of learning is your EMT certification, not your EMR. There's probably that. Sorry about that. Everybody's take the final is going to be, it was just going to be our eligibility test, which counts as our final grade or our final exam for ones that do not want to go take their EMT. So it counts as eligibility and counts as end of course testing for those that are not going to go get their their proof of learning or they get their exam. And your proof of learning is your NCOEMS EMT certification. But it breaks it down by the day. Day by day, day 1. Registration course and course continuum. So, you know, if you have it, you're going, do what you need to do. You know, review of your patient assessment. Your EMT 1, we know that especially in COVID style of learning, that there is a breakdown between the patient assessment and the airway skills that our students are needing to get. Patient assessment and airway were the hardest ones that we saw people wanted to do boot camps with, and having to make sure that we get them the skills they need. From EMR to EMT, whether you're in the classroom or not every single day. So when we come back in from IP21 to IP22, we need to make sure that we do a lot of review on patient assessment, on airway, to make sure that everybody is up to par where they need to be for their airway skills and their patient assessment skills. One of the things that you're going to see us pushing in the next year or so is a really big push we have anatomy down pretty well, but physiology. That means that we need to go do a review for physiology for all of us. We'll figure out a way to do that on one of our our summer conference or our fall conference, and we'll just review physiology. If I need to get Dr. Quigley in here to teach it, I don't have a problem doing that, or get somebody else that's really good at physiology so we can actually understand it. It's more than us understanding it. We have to be able to learn to be able to teach it to where our students can understand it and enjoy it. I won't say enjoy it, but at least understand it. So here's the breakdown for your day by day. It's also here again, your classes and your tests. We have it breaking down to when you should be teaching your NAEMT EVOS course. We're going to do one day at a time, or one set of slides, like slides, PowerPoints 1 and 2. This is something you'll have to do. They are not pre-recorded because the NAEMT will not allow us to pre-record them. They need to be done in classroom. So one thing that has to be lectured in classroom for them. Hear me when I say that. All of the lectures for your EMR and EMT will be done on Edpuzzle, but your NAEMT EVOS will have to be in person. You have 10 PowerPoints you have to go over with these students. So it's all there. All your chapters are there. Your vital sign sheets. There's a lot of other good information on here. You heard me say in EMT 1, they're required to go, your IP21, EMT 1, EMR, they're required to get FEMA courses IS 100, 200, 700, 800. For mine, in my class, for the EMT 2, they're also going back and they're getting FEMA courses IS 317, which is your CERT. 315 is going to be your CERT dynamics when it comes to it's like all your ICS 100, 200, 700, 800, IS 907 and IS 909 courses that I think make them well-rounded to go to be in public safety. So also have days in here for you to do your T-SOAPs. We'll talk more about this when it comes to paperwork and that sort of stuff so you can see it. All right. One of the last couple things I want to do here is I want to go over one of the papers that is actually our plan. Not that one. All right. This is a copy of the appendices for our emergency medical technician, EMR, EMT education plan for the North Carolina Office of Emergency Medical Services for the North Carolina Department of Public Instruction. This is not the application part itself. This is the appendices. So we're going to go over this right here. I want to look at Appendix D, high school and EMR, EMT qualification exam. This will be being updated a little bit in the next year or so, and then it will be turned in next time we have to turn it in, because we're no longer using our SchoolNet. We're making our own test, and that follows us how any of our testing are done right here. Sorry, this next one, I'm sorry. So it says they have to have a qualifying test. They have to have an 80 or higher. So this is in here. We'll be showing your CT directors that this is in here. It's not you making it up. It's a requirement that is set in law. This is our education plan, which makes it law to us. Means it's written in stone and has to be followed. F, how do we validate our test questions? Our test questions are looked at by myself and at least 2 other people for anything that needs to be covered. So the North Carolina Department of Public Instruction Center Career Technical Education Division performs constant validation of each test item in the NCCT program. Procedural terms for contact experts who have taught current course materials are assigned random test items in an online test development system. They answer several key questions about each item, including standards, alignment, correct answer without key given, and the relevance to the actual course. Items not meeting any content validation standards are rejected. Each item is validated by at least 2 teachers on an individual basis. In addition to the teacher validation, the designated education program coordinator, EMT level 2 instructor like myself, reviews the test questions and for quality and qualification of this. Then it can be sent on to our medical director for it to be approved. F. This is where we get what we do. The top part there is all information you've already been known about, but this is where we talk about students will complete an instructor evaluation at the end of each course, the EMR course, the EMT 1 and the EMT 2, your EMT bridge course. Students will complete an end of course evaluation for both these courses. So they're going to do instructor evaluation. They're also going to do a course evaluation. Required. It's in writing. It's in law. Has to be done. Not just because I say so, because it's written in there. It was written there before I ever became the level 2. It needs to be followed. If we're not doing this, OEMS can shut us down. It's there. We need to do it. Not just me making it up. Preceptor evaluations, the students have to fill out a preceptor evaluation on every time they go ride an ambulance. If it's not turned in, those hours do not count. If a preceptor form is not turned in, it does not count. Preceptor could sign the form saying they did 12 hours. But the student did not do an evaluation on that preceptor, then that 12 hours is null and void. Student will evaluate the preceptor in every scheduled field internship or clinical ride time, and the preceptor will do one also. The lead classroom instructor for their LEA will perform at least one test analysis during their course. We'll be talking later and either today or tomorrow about test analysis that we're going to be required to do. Here it is. It's in black and white. We're going to do it. We will all have analysis of at least one test a semester that you're going to do. You guys will analyze your information. I will analyze my information. Then you guys will send me your information and we'll analyze the whole course as all. One course taught at many locations. We'll analyze the same test questions and see what we'll come up with. And you'll be shown what I want you to do to analyze this test information. Level 2 instructor or their designee will perform at least one instructor observation on all training staff instructors in a 12-month calendar year, in person, virtual, or pre-recorded. In writing, required to do it. You don't mean in your classroom, I'll shut you down. Because you're not following the law. Okay? How are we going to do this? I'm not trying to be a bad boy. I'm not trying to be a bad butt. I'm following the law. The way we're going to do this, like I told you yesterday, I'm going to send out a PowerPoint. You will record you doing yourself doing the PowerPoint as if you're teaching your classroom, as you're teaching your class. That PowerPoint will be recorded. You also will record yourself doing a skill, whether it be a skill from that PowerPoint or one I give you, because I'm going to tell you what skill to do, or your regional coordinator will. Then it will be recorded. It will be turned into a YouTube video. So it's going to be two different videos, one for the skill and then one for the actual video itself, and one for the chapter. It'll be turned into us. That video for the PowerPoint will be turned into an Edpuzzle video. And then the skills, both the videos will be watched by us, either myself, Melissa, or Neil, and we'll go through and do your state technical scope of practice, educational scope of practice from that. So this one observation will be done usually by video each year as we get you guys to go back and redo a chapter from the book. I'm not trying to be mean. Please listen when I say this. I'm not trying to be mean, but I'm telling you it will be performed. This will be done. The level 2 instructor, excuse me, I won't be shutting you down. I apologize. I told you wrong. I lied. I didn't mean to lie. I saw it. Dr. Barber will shut your program down because we have to follow the rules. So please forgive me. I said I would be shutting you down. It's not me. It'll be Dr. Barber and DPI. If we're not going to follow the rules, we're not going to have a course that's not going to follow the rules. The level 2 instructor or their designee will perform annual and end of course evaluation of the program to identify any correctable deficiencies in the program using the program summary report. I've already had to do that. I've done part of it. I have to get it done by the end of this this week when you are in the CT summer conference. The biggest thing that with deficiency we have this year is people not getting the P numbers when they're supposed to, and then getting the students registered in Continuum. All right. The policy that requires the completion of an annual evaluation of the program to identify correctable deficiencies. Here's the North Carolina Department of Public Instruction's letter of saying that we're going to do the very same thing that I just told you we're going to do. They put it in place for us. Is that G? G. One other one I want to do. Here's the instructor evaluation. We're not going to use this instructor evaluation because it's too long. We're going to use the North Carolina Office of Emergency Medical Services educational technical scope of practice, which you have to do every 4 years for your level 1 or level 2 instructor. We're going to do one once a year, so you're going to be good to go. You'll have plenty of them. Level 2s have to be checked off by another level 2, and I will check you off as for that last one when you're restarting as the person turning in your paperwork for the state. Now this is the form we have here, and we might actually have to go back to this form if we decide that we want to become an accredited teaching institution with one of the national boards of EMS credentialing, because this is actually the one that they use. It's a bit more detailed than the state one, but I'm not sure yet. So we'll be discussing that when we have our live session. So that's why we have that. It's there. We're going to follow the laws. I showed you guys the pacing guide. We'll review the skill sheets now that we have in place that we'll probably be changing. Then we're done with this one. So it's given me the same thing. So I'm going to end for this actual lesson. This was a review of IP22, EMT2, EMR to EMT bridge. Here again, like I said, I apologize for my attitude. If you take it wrong, please do not. I'm glad that you guys are teaching. I love my job, but I'm a person who sees black and white. I live in a gray world, but we're going to follow the rules. If it's written in our plan, we're going to follow it. If you do not want to follow it, then I have no other thing to do than to say this program that we have within our program is not following the rules and regulations set forth by our education plan. Therefore, I am requesting that you do something about it, Dr. Barber, and I can tell you what Dr. Barber is going to do. He's going to give you a little bit of time to get compliant. If you're not compliant, your course will be shut down. We're going to be one course taught in many locations, following the rules and regulations that we have in our education plan that was sent and approved by the North Carolina Department of Public Instructions. Here again, my tone of voice is sterner than you guys are used to hearing me say. The next couple of videos will be much less stern. And hopefully when you guys, the ones that don't know me, I'm not a meanie. I am just a stickler for following the law. Thank you guys for being here. Thank you guys for teaching the EMT program and the EMR classes to our students. Thank you for what you do for our students on a daily basis. Thank you for caring for your patients, your community, and your students. Thank you, and I'll see you in about another hour.